Let's take a moment to talk about the medical management of increased ICP. This is a ventriculostomy drain that can be used to continually drain cerebrospinal fluid, which can help to control ventricular hypertension, and it can also be used to drain blood from the ventricle in the instance of a subdural hematoma. It can also be used to instill medicines like antibiotics, or it can be used to instill dye. Complications of ventriculostomy drains include infection, meningitis, and ventricular collapse. It's also very important that the transducer be level and aligned with the foramen of Monro while the patient is laying flat on their back. Ventriculostomy drains allow for the intracranial pressure to be monitored and also drained as necessary, but this has to be done in slow amounts because if you drain intracranial fluid too quickly, you increase the risk of having a cerebral herniation. Cerebral edema is decreased through the use of osmotic diuretics, such as mannitol, and that dehydrates the brain tissue and reduces cerebral edema, and this is used for intracranial pressure related to head injuries. Edema may also be decreased through the use of corticosteroids, like Decadron, but this is only used to decrease swelling around a tumor on the brain, not for head injuries. Because fever can increase cerebral metabolism and that can increase edema, it has to be controlled with antipyretics. You might even see a hypothermia blanket being used on these types of patients. Maintaining oxygenation remains a priority for these patients. Pulse oximetry has to be monitored along with arterial blood gases to ensure that the patient is properly oxygenated. Remember, increased CO2 levels make blood vessels in the brain vasodilate, which can worsen edema because metabolic demands can increase the body's temperature and worsen cerebral edema. It has to be controlled. In this case, we may give sedatives such as barbiturates, like phenobarbital, to induce a comatose state, and that will decrease the metabolic demands. Sometimes we have to sedate the patient so much that they can no longer protect their airway, and they may require an endotracheal tube and mechanical ventilation in order to breathe. Remember, protecting the patient's airway is always the top priority. For more videos related to nursing care, be sure to like and subscribe. See you soon!